Chapter 4 Ethical Issues in Health Professions Education Research. An Ananthakrishanan, Shanthai Ananthakrishanan. Abstract. Ethical issues are important for judging the quality of research. Unfortunately, the importance of ethical conduct of research is not taken seriously in health professions education research in comparison with rigorous guidelines practiced for clinical trials. There also exists considerable variability in dealing with the ethical issues among different countries. As a result, a young researcher is often confused about the standard practice which should be followed in HPER. This chapter highlights the perception change regarding HPER from being considered non-harmful and a mere audit to one which is now on par with social science research regarding strict regulatory guidelines. The inputs which led to this change have been highlighted. The principles and practices of bioethics viz. Confidentiality, autonomy, informed consent, beneficence, non-malfeasance, inducements, influence of hierarchy, and conflict of interest have a slightly different perspective in HPER settings. These considerations will have implications for the procedures to be followed by the institutional review boards and ethical committees, which have been highlighted in this chapter. Though the chapter is contextualized in the Indian scenario, it is possibly applicable in other similar environments. Key words: medical education, ethics, ethical principles, health professions, education, research. Assess need. Medical research is growing with great rapidity along with growth in medical knowledge due to various causes. It is estimated that the doubling time of medical knowledge in 1950 was 50 years, in 1980s 7 years, and in 2010 3.5 years. In 2020 it is projected to be 0.2 years, just 73 days. Along with expanding medical knowledge, health professions education research is also growing. Yet there are still skeptics in the medical professional community who scoff when the term medical education research is mentioned. There is lack of appreciation of the value of research into various aspects of medical education in our medical schools. This is unfortunately because education research does not fetch big grants or lead to great recognition in the health profession and remains a poor cousin in the research field. There is an even greater degree of unawareness regarding the ethical issues concerned with HPER. Teaching of ethics to medical students and postgraduates has been largely ignored till recently in India, leaving young faculty researchers without a proper understanding of ethical issues involved in research. It is not so only in India, it is so in other countries as well. HPER is what facilitates an understanding of what works or does not work as well in the teaching, learning process and in the organization of the curriculum and provides information enabling decisions regarding improving the quality of the outcome. An educational research based on planned, systematically obtained and analyzed data is a stimulus for quality control and improvement. In the past, research in medical education was largely a process of auditing of existing teaching, learning, or curricular practices, comparing them and drawing conclusions as to which one was more superior. Waiver of ethical approval was the norm then. There are still countries where this situation exists. R. Kate mentions that the Netherlands is among those countries which do not require ethical approval for medical education research. However, this is not the situation in many other countries, including India, where a rigorous approval process is mandatory. Brief. This chapter will deal with issues regarding possible ethical pitfalls in the conduction of research in health professions education, guidelines regulating this type of research, process for getting approval from the concerned ethics committee, taking care of concerns of students, understanding the principles of conflict of interest between the role as a teacher and that of a researcher. CO and 3XTUARIZE. Some of the incidents narrated below will highlight the issues which may arise in health professions. Education research. A first MBBS student was asked to participate in an educational research by a teacher who wished to relate their learning styles to their performance in formative evaluation. Since the student was told that participation is voluntary, he declined to participate. Subsequently, in the summative examination, the same teacher was the examiner. The student failed and attributed his failure to not participating in the teacher's research. His parents also lodged a complaint since the student was below the age of consent as per Indian law and their permission for participation was not taken as is required in Indian guidelines. A PhD proposal was submitted to the Ethics Committee for assessing the effect of emotional intelligence and motivational interview training to undergraduates to improve their interaction with patients. Half the batch was to be used as controls with no such training, and the other half was the experimental group. The ethics committee declined to give consent since one half of the students was being deprived of the benefits of a process which has proved in other countries to contribute to improving communication with patients. The committee suggested that the experimental model may be modified to use historical controls or the students who are not given the opportunity of emotional intelligence and motivational training during the experimental phase should be given this training after the experiment is over. Describe introduction. Research in medical education is still largely based on observational studies and on undergraduate medical education. These two constitute 69% and 62% respectively of HPR. There are far fewer publications based on research on effects of continuing medical education or postgraduate training. Previous studies were largely educational audits performed for quality control, which were not always meant or suited for publication. Hence, an atmosphere of laxity prevailed. Currently, more and more qualitative methods are used with planned and intrusive interventions in the educational process, some of which involve sensitive issues. As such, while in the past the process of approval of education research was practically non-existent, and almost automatic as it was considered non-damaging. It is now subject to more rigid guidelines like other social sciences research and is similar to that existing for health research in general. It is, therefore, necessary for all researchers in the field of health professions research to be aware of the current guidelines and avoid the pitfalls which might result in refusal of permission by the concerned regulatory authority. Existing controversy. Or Chan Kate has mentioned three main factors in medical education research as stated below in justification of not having strict guidelines regulating educational research. 1. Students determine the outcome of educational interventions far more than patients can determine the outcome of medical interventions. The argument being that their participation is therefore mandatory and should not be curbed. 2. Potential harm resulting from education experiments does not compare with potential harm from medical experiments. The implication here is hence research regulations need not be as strict. This hypothesis is, however, subject to dispute. 3. Why require ethical approval when methods are compared within cohorts, but not historically or interinstitutionally? This opinion is obviously not unanimously approvable. This is the reason that in the Netherlands no formal ethical approval is required for HPR. This premise has been disputed, and the reasons why it is disputed will be discussed. The movement from mere audits to more and more social science research in education with sometimes intrusive questioning of personal details and intergroup comparisons without an opportunity of all to benefit by the intervention has led to this shift in perspective. Hence, the movement from laxity in permitting educational research to a great degree of strictness by applying the same ethical rules for education research as applied to general health research. ICMR in its guidelines on ethical issues in social and behavioral science studies says that the risks of such research are non-measurable and dynamic in nature and therefore might be misconstrued as being in the category of no risk or minimal risk research when in fact they are not so. Hence, special precautions need to be taken considering vulnerability, hierarchical pressure, confidentiality, principle of primum non nocere or above all no harm and voluntariness in obtaining informed consent. The Indian guidelines say that for social and behavioral science research in which some aspects of education research falls should conform to strict guidelines. Changing perspectives. Educational research has for a long time had the privilege of enjoying a special status amongst research activities being largely exempt from strict oversight. This attitude was welcomed by researchers in HPER since they felt that IRB members do not possess sufficient knowledge about research in education to be eligible to be regulators. In fact, there have been accusations of bias against the IRB regarding issues concerned with qualitative educational research. To overcome this objection, the Code of Federal Regulations of the USA, Code 45 CFR 46, specifically mentions that IRBs should have representatives who represent a range of perspectives and interests, including at least one member of the community who is not part of the organization and one member whose chief interests are non-scientific, such as a lawyer, a layperson, or a clergyman. These rules also apply to regulations enforced by the Indian Council of Medical Research in their guidelines on research on human participants. The only area exempt from requirements of 45 CFR 46 is research conducted in established or commonly accepted educational settings involving normal educational practices such as research on regular and special education, instructional strategies, or research on the effectiveness or the comparison among instructional techniques, curricular or classroom management methods. In the above circumstances also, the Commission set up for prescribing rules for educational research laid down that even in areas exempt from strict regulation as stated above, there should be a process of administrative review in every case. This led to several universities prescribing more and more stringent rules to govern educational research for fear of litigation. It has been suggested in this context that to make an appraisal of what constitutes a normal educational practice as defined above, there needs to be a board comprising of external members who are educationists. Current perspectives. Ethical issues in educational research may arise out of breach of prescribed well-known ethical guidelines common with other health research or be specific to educational research only. The common areas usually pertain to issues concerned with management and organization of the research, data handling, plagiarism, and issues concerned with publication ethics, etc., which are all common to other types of research, and other issues which are specific to education research. The potential issues of concern are mentioned below. 1. Research management issues, grant issues, will research supervision, C. Data handling and management, D. Confidentiality, E. Fabrication and falsification of data. F. Data analysis issues. 2. Publication ethics issues. Copyright infringement. B. Plagiarism. C. Citation and referencing issues. D. Authorship and other publication ethics issues. E. Conflict of interest. F. Peer review issues. 3. Issues specific to education research. Data handling and confidentiality. B. Discrimination issues both due to participation or non-participation. Principle of beneficence and non-malfeasance. C. Vulnerability of subjects. Principle of autonomy. D. Age of the research subject. E. Informed consent procedure. F. Hierarchical organization in an educational institution. This chapter will predominantly focus on issues specific to HPER since research management issues are common to all research and outside the scope of this chapter, and the issues on publication ethics have been dealt with in a separate chapter. Vulnerability and compromise of the principle of autonomy. The greatest concern in planning interventional research in education is due to a perception of vulnerability of the student population. This is a real issue since students largely constitute the subjects of educational research. It is considered that in the background of a very strict and overbearing hierarchical system in the medical colleges where the teachers have supreme authority, the ability or the independence of decision making of a medical student to withhold informed consent is seriously compromised. This is because there is a feeling, perhaps rightly so, that non-participation may result in adverse consequences in the summative examination process or academic career progression. ICMR in its national guidelines for biomedical and health research involving human participants has classified students among individuals who have diminished autonomy due to dependency on being under a hierarchical system as a vulnerable group. As per guidelines laid down by ICMR, being research on a vulnerable population All proposals for such review should come for a full board review of the concerned ethics committee. To avoid this concern of exploiting a vulnerable population, it may be advisable, where feasible, for a teacher to avoid research on his or own current students under his or hierarchical control. Students should be treated as vulnerable, and mandates to participate should be avoided. All educational research should preferably be part of the curricular process with provision for a crossover when comparing instructional methods. This is because innovation may be better or worse than the current practice and may be either harmful or beneficial to a selected few students only. One may also consider doing the research during extracurricular hours using academic break times. By carrying out research during spare time, students are not inconvenienced and their interests are not adversely affected. However, they should have the freedom to either participate or not participate without fear of adverse consequences. Beneficence and non-malfeasance. This especially applies to comparison of different teaching learning methods during the curricular process between two groups of students, one of which is in the new intervention group and the other in the control group with the old methods. In this situation, if the new instructional strategy has been shown to be clearly and unequivocally superior to the old one in other studies, then having two groups of students, one for the experimental group with the new interventional strategy and the other for the conventional intervention would be unethical unless those who missed out on the new instructional strategy during the conduct of the experiment are given an opportunity to learn by the new strategy after completion of the experiment. This objection would still apply even if informed consent has been obtained to be in the control group, since this would be perceived to be due to hierarchical pressure. Hence, in any such research involving comparison between two groups of students, there must be a crossover so that the benefit of the new intervention accrues to both groups for another topic of instruction. Informed consent procedure. Informed consent for participation in the study must be obtained by an independent member of the research team who is not part of the hierarchy of educational control and who is not involved in the teaching, learning, or assessment of the experimental subjects. Full information must be given on the purpose and consequences of the research, the benefits or potential harm which may accrue to all or some of the students, and they should be explained. When in the control group, that they will also have an opportunity to experience the benefits of the new intervention for a future lesson. Opportunity and freedom to withhold consent must be provided, as also an opportunity to withdraw from the study at any time without assigning reasons without adverse academic consequences. The informed consent process must educate the students about privacy, anonymity, equipoise, equitability, beneficence, and non-maleficence, etc. There is yet another issue regarding informed consent. In India, many of the students who are the subjects of research, including in health professions, education institutions, are below the age of legal consent, which is 18 years as per Indian guidelines. Hence, serious consideration must be given to the need to get the legal guardians involved in the informed consent procedure. The procedure for obtaining informed consent for research for those below the legal age of consent is detailed in the ICMR guidelines. It has been suggested that the IRB should focus on the process of consent rather than the wording of the consent form. For online questionnaires requiring anonymous feedback from students as part of research, the researcher must ensure that there is no way that the identity of the responder is revealed to the researcher and it remains anonymous. The students should not be asked to enter any identifiable data as part of filling up the questionnaire. They should not be asked to use their universal ID no, or their mobile phone numbers for responding, as these would be identifiable. Process of obtaining approval from IRB or Institute Ethics Committee. The researcher should first determine whether the project qualifies as a research or a mere evaluation of existing practices. If it is an audit whose results are meant for local stakeholders to improve the curricular process without publication, it may not qualify as research. If, however, it is intended for publication and general dissemination to add to the body of knowledge, it qualifies as research and requires ethical approval. The former may require only administrative approval, but the latter requires a formal application for approval to the IRB. If the IRB deems that the research is based on data already available, which is being put to a secondary use for publication, ensuring total anonymity, it may grant a waiver of approval after an expedited approval process. If, however, the committee feels that vulnerable population is involved, it will go for a full board review. IRB review process. All educational research which does not meet with the criteria of an in-house audit of practices must be submitted as a protocol to the IRB or the Institute Ethics Committee. Based on the protocol, the purpose of the research, and the consideration of vulnerability issues, it is for the IEC to decide whether a formal waiver may be issued or whether it requires a full committee review and appraisal. The consideration is based on a case-by-case study and cannot be generalized. The IRB is likely to study in detail the age of the participants, issues of vulnerability, the informed consent process, intrusiveness of the data collection proforma, post-study usage of data, and such other issues. The standards of approval are very similar to social science research, although it may be less stringent than health research involving patients. Use of secondary data. Often there is a perception amongst researchers that if data is already available, it may be used for future research without any further approvals. This is an incorrect assumption. For example, there was a study in one institution to correlate the marks obtained in school leaving examination with academic progress after admission to a professional institute based on formative and summative examination scores. Although these scores were available with the academic section, it requires a second detailed proposal to the IEC describing the purpose of the study for fresh approval. Likewise, use of previously obtained data, such as school leaving marks, for classifying students into those requiring additional curricular support, even with the justifiable intention of providing additional curricular support, still requires approval if the intention is to publish the research. Confidentiality. Participants' identity must be protected while disseminating findings. The researcher must remember that inclusion criteria by themselves may serve as identifiers. To avoid this, it is better to conduct a multidisciplinary or multi-site research. This will also indirectly reduce the chances of being accused of exercising hierarchical pressure. If participants agree to have their identities revealed, this decision has to be made by the ethics committee after verification of the consent process, and permitted only if necessary for the study. Data must be anonymized before it is provided for consultation by faculty. In the case of teachers involved with active teaching of the subject student participants, only independent research team members should be involved in collecting student information. There are two types of anonymization: anonymized data, irrevocably stripped of all identifiers, and de-identified data where the identifiers are replaced by a code kept by the independent member of the research team. This latter must be under strict control to be provided only where necessary on approval of the IRB. Data must be protected against unauthorized access by measures such as physical safeguards, data stored under lock and key, administrative safeguards, enforcing organizational rules regarding privacy, technical safeguards, encrypting, password protection, etc. Avoiding inducements. Participation in research should not fetch extra credits in the curricular process to the student participants. This would be considered an inducement which is unfair. This will also jeopardize participants' right as per the Declaration of Helsinki to withdraw at any time without assigning reason from the research. Liebchens and Levinson, 2013. Research by medical students as part of the curricular needs. There are no specific guidelines on medical students pursuing short-term educational research projects as part of their curriculum. In situations where the risk is less than minimal, as in situations where it involves mere analysis of data already available in records in an anonymous manner, without any sensitive new issues being raised as part of the current research, auditing for quality control, etc., strict scrutiny may not be required. These may be submitted for exemption from review as per ICMR guidelines. In situations where comparison of instructional techniques is involved, particularly one whose superiority is obvious or has been noted in other studies, research is permitted only if all students have the benefit of the new intervention after the completion of the study and do not miss out on the advantages accrued to their fellow students. As per ICMR protocol, all studies involving vulnerable populations, such as students, must undergo a full committee review, and is not subjected to a waiver without review. The general opinion about student research is that there cannot be any laxity regarding research done by the most inexperienced member of the research team, such as students, in comparison to those governing more experienced members. Summarize. This chapter highlights the perception change regarding HPER from being considered non-harmful and a mere audit to one which is now on par with social science research regarding strict regulatory guidelines. The inputs which led to this change have been highlighted. The following principles of bioethics which apply to HPER have been discussed in detail with I. Vulnerability and compromise of autonomy. I. Principle of beneficence and non-malfeasance. I. Question of inducements or hierarchical compulsion. If informed consent procedure, V. Confidentiality. Y. Procedure for obtaining consent from the IRB or the IEC. VI. Secondary usage of data collected for previous research. VI. Implications of students doing educational research. Evaluate. It is hoped that after perusal of this chapter, the reader will be able to find answers to many questions, some of which are listed below pertaining to HPER. 1. Why has there been a change in perception regarding HPER from a belief that it was non-damaging to the subjects of research to the current practice of requiring strict regulation? 2. What measures need to be taken to protect the student population, who largely the subjects of research, in view of their vulnerability? 3. What are the principles and practices for obtaining informed consent from students for participation in HPER? 4. What types of HPER may be exempt from strict scrutiny by the IRB and be eligible for a waiver of approval? 5. What steps need to be taken to protect confidentiality in HPER? Road ahead. This has been aptly summarized in a paper by Boileau et al. In Medical Teacher in 2017. The tips modified from her paper are as follows. 1. Determine whether your project qualifies as a research or as a mere audit of existing practices. 2. Verify need for consent for secondary use of data obtained during normal academic process. 3. Ensure free and informed consent of subject participants. 4. Obtain consent through independent member of the research team. 5. Ensure confidentiality of participation. 6. Ensure data is anonymized before appraisal by faculty researchers. 7. Protect participants' identity. 8. Safeguard research data. 9. Treat student participants as being vulnerable. 10. Consider doing the research in extracurricular time. 11. Avoid impression of positive or negative inducements. 12. Ask for a thorough review by the IRB or the concerned ethics committee to safeguard researcher and subjects.